Hi there. Klumpke's palsy is one of the most preventable medical conditions that can occur in birth injury. Klumpke's palsy occurs typically because a child is stuck in the birthing canal and the doctor pulls too hard and affects the nerves that are coming out of the child's mid-cervical spine. So let's dive into that a little bit deeper. What happens is the child gets stuck on the way out of the birthing canal. The shoulder becomes stuck behind the pubic bone of mom. When that happens, the doctor has to make a choice. He has to use a different technique to pull the baby out. He can pull the baby out with forceps, a vacuum, or even his or her hands, but the most important thing is how it's done and how much pressure is actually used to pull the baby out. If the doctor does this negligently, then it can cause severe problems to the nerves in that brachial plexus area. This is the cervical spine up here. However, it can also cause injuries to the cervical spine down below the upper area of the cervical spine. We call that the mid to lower cervical spine area. If those nerves are stretched or torn or even pulled out from the root due to the doctor's negligence, then Klumpke's palsy can occur. That is when the arm, the hand, and the fingers can be affected and not be able to be used in certain situations. This can lead to a lifetime of injuries and therapies and medical treatment that are necessary for the baby. If you or a loved one had a baby and who suffers from Klumpke's palsy, then you may have a medical malpractice claim and you need to speak to a birth injury lawyer about it. My name is Adam Funk and I am a birth injury lawyer. I'd be happy to chat with you about your case free of charge. You can email us, text us, call us, and we'll schedule a time for you and I to chat.